Olivia, Sightsavers are one of my favourite organisations that have a base in Ireland but that work abroad in developing countries. A lot of our listeners will probably know who Sightsavers are, but for those who don't, could you remind us as to who you are and the work that you do, please?
Sure. Hi, Darren. Thanks a million for talking to us. So Sightsavers is a global development charity, and basically we're working to eliminate avoidable blindness, but we're also working to promote equal opportunities for people with disabilities. And we work across the developing world in over 30 countries at, I suppose, 3 different levels. So we're working to eliminate blindness and restore people's sight. And at the same time, we're campaigning for change, so that the reasons that people go blind in the first place are tackled, and we're also supporting equality. So we're working to make sure that people who have permanent blindness and people living with disabilities have the same right to go to school, have the same opportunities to work. So that might be, something like providing supports like Braille books or reading glasses, or it might be working with the government to make sure that people get the opportunity to go to school in the first place. And the reason Sightsavers works like this, maybe I'll just share, I don't want to bore you with statistics, but it's really astonishing actually. At the moment there are 39 million blind people around the world, and 80% of that blindness is avoidable. And actually 90% of visually impaired people live in developing countries. So it's really shocking and really unfair when you think about all these people whose lives are completely changed because they live with blindness, often caused by neglected tropical diseases, or a medical condition that could be treated. So that's exactly what we're working to do.
And is it true that Sightsavers are the biggest organisation who have a base in Ireland who are working on the issue of people's eyesight in developing countries? Like, for example, I used to think that World Vision did the same thing until I learned a year or so ago what World Vision do. Could you just explain the difference between yourselves and World Vision, please?
Yeah, no, I'm no expert on World Vision, but I think World Vision work on broader development issues. We ourselves we do work in collaboration both in Ireland and at a global level with the World Health Organization and other organisations working to restore sight and to fight for people with disabilities. So here in Ireland we lead at the moment the DOCUS Disability Working Group. So we come together with the likes of Christian Blindness Mission, and we work with Plan Ireland, and we work with Oxfam and with academics and experts to make sure that people with disabilities and people with sight impairment are really considered when Ireland is supporting development, just making sure that people are thinking about them in all the human rights interventions and all the ways we're trying to tackle poverty.
Yeah, I used to think that World Vision were kind of similar to yourselves, working on people's eyesight, but World Vision don't do that, I don't think, at all. They're kind of a development organisation specifically working on like different things, but I don't think they do actually people's eyesight, don't they?
I don't believe so. But as I say, I'm no expert. But I think they're broader kind of development. And I think, as far as I know, they're a church affiliated organisation who work in development.
Yeah. And you have some big international campaigns at the moment, don't you?
Yeah, we do. So maybe I'll just tell you a little bit about our work, the kind of the 3 streams we work in, and then we have campaigns relating to those. So every year we support our partners to carry out millions of eye examinations, and then we refer people for treatment. So we might send someone for surgery to restore their sight, or it might be a case of providing glasses to make sure that someone can see. They could be, for example, a truck driver or a farmer who can't do their work because of their sight impairment. And we work with community volunteers to distribute medication to prevent two neglected tropical diseases that cause blindness, river blindness and trachoma. And we also work to train eye healthcare workers and surgeons and hospital staff and government staff in order to offer the surgeries and the treatments. So in working to prevent blindness, we have our Million Miracles campaign, which is a campaign to fund 1 million sight-saving cataract operations. And actually we've managed to give more than 1 million people back their sight as a result of cataracts, which is really amazing. At the same time, we know that people aren't just blind because of illness. In fact, the vast majority of people who are blind in developing countries are female because Often certain types of blindness relate to poor hygiene and hand-to-hand contact, and mothers do a lot of the care work. And equally, it's, lack of access to clean water can really, really help spread a lot of the neglected tropical diseases. So we're also working with national governments and campaigning in countries for change, so that people with disabilities are included in school systems, are included in initiatives for equality, but at the same time making sure that governments are doing everything they can to prevent avoidable blindness. And then at the same time we work on equality through our Put Us in the Picture campaign, and that's all about putting people with disabilities, including blindness, right in the heart of government plans. So that's looking at making sure that children who are blind get to go to mainstream schools, so they have the exact same opportunity to learn, and then in future, to go out and earn a living and to do things that all other children get to do, or making sure that people can get back to work and can, interact with their families again.
I saw a video on your Facebook page recently about the Global Goals for Sustainable Development, or SDGs. It is true to say, isn't it, that you are big supporters of these goals?
Absolutely. Sightsavers is 100% behind the Sustainable Development Goals. We're really active. And the Sustainable Development Goals are a big set of goals looking to tackle global poverty. So the first goal is an end to poverty. But actually we see all our work as contributing to the Sustainable Development Goals broadly, and then in some cases specifically. So I think when people think about our work to eliminate avoidable blindness, people usually think of SDG 3, which focuses on good health. And a lot of our work directly focuses on this. So maybe just to give you an example of what that means, our Kenya trachoma elimination program, that's a bit of a mouthful, but our work in Kenya to try and fight trachoma, a disease that causes blindness, is currently providing surgery to 41,500 people who are at risk of going blind. So this means that all those people will be prevented from going blind and living with a disability, and it means that they can, in some cases work on their farms, go back to school, look after their families, just have the freedom and equal opportunities that we want them to have. At the same time, in India, actually, we're working with truck drivers, so we're screening, I think it's 400,000 truck drivers to see if they have any visual impairments, and that obviously helps contribute to good health and well-being under the SDGs. But at the same time, we're really looking at a specific one, which is to reduce road traffic deaths by 50%. So by providing 400,000 truck drivers with glasses, it just means that the roads are going to be much safer for the drivers themselves and people on the roads. And then there's a much bigger piece. So we're also working on SDG 4, which is quality education. And maybe this might be interesting to Irish listeners, because we're very lucky to receive funding from Irish Aid to support inclusive education work in West Africa. And at the moment, Sightsavers is working in Senegal to make sure that children who have disabilities get to go to mainstream schools, and that governments are looking at this to make sure it's rolled out. So we've had a programme for a number of years in Senegal, and it's been so successful in making sure that children with disabilities have the exact same education as others, and that the supports that they need are used in the school, that the government are looking at rolling that out across the country. So that'll make a huge difference for children's lives and education. And I suppose I could go on. I mean, SDG 10 looks at reduced inequality, and of course, if you can gain your sight back, you gain a lot of freedom with that. So that's really key, because you can imagine, losing your sight might mean you lose your livelihood, your ability to work, your ability to just feed your family, look after your children. All the time we meet people who, feel like they've lost their sense of themselves and their ability to contribute. So by giving people back their sight, you really give people back a lot of independence economically and personally to enjoy their lives. So the work kind of cuts through a lot of the SDGs. And we're also working at UN level to make sure that we're promoting blind people's rights and disabled people's rights, so that they are considered in all the ways that we're working to tackle poverty.
Yeah, you have a big section on the SDGs on your website, don't you? It could be the international website now, I'm not sure.
Yeah, you can find loads of information on the SDGs on the Sightsavers Ireland and the Sightsavers Global website. So it's www.sightsavers.org. .ie, and you'll find a link actually to have a look at that.
Along with your big international campaigns that we spoke about a few minutes ago, you have other activities, don't you? Like junior, that's your name though.
Yeah, that's great you mentioned that actually. We're launching Junior Painter of the Year this month. So that's been running in Ireland for almost 10 years. And basically each year we contact every school in Ireland and we ask primary school children to do some art. And this year we are asking people, or children I suppose, to really think about why all children should have the exact same opportunities. So we're asking them to draw a piece of art about putting them in the picture as children, and they can submit that to us. And we have 3 fantastic judges. Sinead Burke, who many people might know as Minnie Melange from her social media account. She recently gave a great TED talk. And we have PJ Lynch, who is the current laureate in Nogue and a really, really well-known illustrator and artist himself. And Porrick Naughton, who is the Director of Arts and Disability in Ireland. So our 3 judges are going to be reviewing all these paintings, and we'll have regional winners and national winners, and we have cash prizes for the schools, which are kindly sponsored by the Book Centre. And we also have some really, really exciting art prizes for the schools and the kids themselves. So it's absolutely worth getting involved. It's a great thing to do in the classroom, to talk about children's equality, the importance of education and equal rights for everyone. And it's really, really good fun to do a bit of art. And the closing date for that is just before Christmas. So for schools to get involved, they can just head onto the website and we can send out information.
Yeah, and you had something on there recently. I was hoping to interview a week earlier to cover it, but Bright for Sight, that's over now, is it?
So yeah, last week was our Bright for Sight Day, and actually it was a really big success. So we asked companies across Ireland to get involved by wearing something yellow to work on September 8th. And it'll be an annual event, so people can start thinking about it for next year. And the reason we ask people to wear yellow is because yellow is the colour that's most easily identifiable to someone with a sight impairment. So it's really simple. You wear yellow to work and you can make a small donation. And it's really fascinating actually. A small donation can make such a huge difference to the work. It's something that really, really shocked me when I first started learning about these things myself. It's such a low amount of money. €2 can provide a pair of glasses to someone in a developing country, and that can be the difference between someone, being able to work or not, or a child being able to learn the same as their classmates. Like for example, €36 pays for a sight restoring cataract operation, so giving someone back their vision, and €56 for a child. So really, really small donations from companies in Ireland are really changing people's lives in developing countries and giving back freedom, and it's incredible. And we had some pretty big and lots of local companies take part. So if anyone happens to be on social media, you'll see loads and loads of photos of people in Navan and Galway and Kildare, in Cork, all over the country wearing yellow last Friday to mark that. And we'll be running the same thing next year. But there's loads and loads of ways for companies and individuals to get involved if they'd like to support our work. You can easily fundraise for us, but at the same time, if you have a bit of time, you can help campaign for us and work for equality. So there's loads of ways to get involved, and you can have a look on our website or our social media for those.
Yeah, I was just going to ask you there about that, about Sightsavers and your supporters, people who give you money. How much do you depend on your supporters?
Well, really, it's people's generosity that helps change people's lives. It's really incredible what people in Ireland and across the world have helped us to do. Maybe just in the last year alone, I can tell you what people donating money have achieved. So this year, thanks to donations from the public and from companies and from institutions, Sightsavers has been able to facilitate 260,930 cataract operations. And on top of that, another 62,000 sight-saving operations. So that's over 300,000 operations to give people back their sight or prevent them going blind. And then on top of that, I mentioned 2 really, really awful diseases that people suffer from that cause blindness: trachoma and river blindness. And as well as being, as well as causing a loss of blindness, these also cause really, really painful symptoms and really affect people's lives. Very, very painful. And in the last year alone, thanks to support from donors, we've managed to give out 47 million treatments against river blindness, and another 24 million treatments against trachoma. So each one of those people is then prevented from going blind for a year. And it's really interesting. It's actually amazing how this is done. We work with local volunteers. We train people to distribute these in their own communities. And the drugs are very often donated by pharmaceutical companies for free. So a lot of this work is done really cost efficiently because we train volunteers who weigh and check the height of people living in their communities, and they distribute the drugs. And the pharmaceutical companies often donate the drugs. So a very small donation means that we can offer that training in a community and reach a huge amount of people and prevent blindness. So it's really incredible.
Do you accept Irish opticians or other people working in eye health and kind of send them abroad, or do you work with people in developing countries to let them do it themselves, or what?
It's a really good question, actually. It's one that we get asked all the time. So we really work in partnership. And going back to the SDGs, I think that's one of the final goals. The way Sightsavers work is that we really, when we're working in a developing country, we're not there to offer services forever and ever. We're working with local communities and with local hospitals, the Department of Health, the Department of Education in each of these countries, to make sure that they're strengthening their own systems so that they can help people in the long term. So we work to train opticians, ophthalmologists and ophthalmic surgeons in the countries, as well as the volunteers I mentioned. And that means that in those countries, Sightsavers is making a system that prevents people from going blind in future, as well as treating people who have avoidable blindness right now. So we really, really work in partnership with local partners, with national NGOs and organisations for people with disabilities, with governments and at the UN. But at the same time, we do work with a lot of ophthalmologists in Ireland who have been able to offer support in lots of different ways, be it through expertise, raising awareness. So there's lots of different things that people can do. And definitely we'd encourage anyone, opticians or anyone with an interest in Ireland, to do this. And it's fascinating, so many people who give to Sightsavers, who give generous donations, or who give their time, are often people who experience this themselves. And I know my own grandfather had cataract surgery last year, and it was amazing to see. I mean, a surgery, he was in and out of the hospital here in Ireland, and he was only waiting for a few months for it. And immediately he could drive again. He had the independence to be able to go to the shops by himself again. All of a sudden he was reading the paper, he was enjoying his walks. A complete transformation in his own life. And I think people often think of Sightsavers when they've been through something like this. And it really puts it in perspective. You can see that a simple operation like that can completely transform someone's life, and for such a small amount of money you can really give something huge to someone who needs it. So I think that's often how people find our work.
To talk about river blindness for a second, is river blindness, does that not need an operation? It's medication, is it?
It's a really good question. I think it's something that people wonder about a lot, because obviously it's not something we'd be really familiar with in Ireland. So basically, river blindness is a disease that is part of what we call neglected tropical diseases, and it's spread through the bite of a black fly. And they tend to be found around fast-flowing rivers. And when they bite people, people are infected with a parasitic worm. So the river blindness is caused by the worm, which is left under someone's skin, but it takes a very, very long time to develop. So actually, it causes a lot of itching, but over a very long period of time, people will develop blindness and can also develop a lot of other physical disabilities. It's really, really terrible. And there's a really, really simple solution. Basically, it can be prevented by giving people an annual dose of a drug called Mectizan. And a dosage of Mectizan costs about 7 cents per person. So it's really phenomenal.
And how long do you take it for? Once a year, is it?
You take just one dose a year. A long time ago they used to use, they used to drop insecticides by air, but actually, I mean, this drug really is a miracle in that it's just very, very simple. Like I said, our volunteers give this out once a year in their communities, and that prevents.
And they get it every year for the rest of their life.
Yeah, exactly. In an area that's inclined towards it, so we wouldn't need to take that here, but it's made such a difference because it prevents people from developing river blindness. so developing physical disabilities and losing their sight. And actually, once upon a time when the black flies would come to an area, you'd see people would have to leave because people didn't want to go blind. So they might lose their agricultural lands or have to lose their crops for a period of time. So not only has it prevented people from losing their sight, but it's also helped people stay in their communities and their livelihoods. Children don't leave school, people don't leave work and leave their farmland. So it's really transformative. And you can imagine, 7 cents for a dose, such a small amount of money to make sure someone doesn't go blind.
It's unbelievable. Like you already said it a few minutes ago, how far money goes in developing countries. Like €5 or €10 in Ireland is not going to get you a lot of things, but €5 or €10 in most countries in Africa and other developing countries can go so far. It's unbelievable, isn't it?
Yeah, it's incredible actually what a difference such small amounts of money can do that. And I think it can be a little bit overwhelming sometimes to see the scale of problems, but actually when you see the scale of solutions, like I mentioned, this year alone, our donors have funded hundreds of thousands of operations to restore sight or save sight. So I think sometimes we think this is a really big problem, but actually for a very, very small action, you can have a tremendous impact. You can really, really change someone's life. I can tell you if you like. So €4 pays for the lens in a cataract operation, €2 pays for a pair of glasses, and €36 pays for a cataract operation. Whereas €543, which is a larger amount, but that can pay for the equipment to perform a surgery. And you can imagine that equipment can give so many people back their sight, and it can mean that you can reach harder, more remote places, so people don't have to travel or aren't prevented because of poverty from accessing that. And then, this is a much larger figure, but you can imagine the change this makes. Like €1,265 is enough to train an ophthalmic surgeon, and that's someone who can, perform an incredible amount of surgeries to save sight. We have surgeons who are working in communities, and in a day they get through, sometimes they'll have 3 or 4 cataract surgeries in an hour and work a 12-hour day. So you can imagine what that does in a community. It's really, really incredible how a tiny donation goes a really, really long way. So in December this year, on December 12th, Sightsavers is celebrating its 1000th treatment. So that's the 1000th treatment for neglected tropical diseases. And it's a pretty exciting achievement. It's celebrating 1 billion treatments that have helped prevent people from going blind. So we're going to be having some celebrations in the communities where we work. And here in Ireland, we'll be inviting people to really celebrate this special moment, because it's really thanks to our supporters, individual people who are incredibly generous and have gifted us money, companies, Irish Aid, and different people who really, really support our work, who've made this happen. So we're inviting people to join us on the 12th of December for a special event to celebrate all the lives that have been changed as a result.
Yeah, I was just going to finish up now, unless you have more to say. If people want to find out more about the event in December that's going on, but also just in general, I know we're on Spencer Row at the moment. I know you have recently moved from Dunleary, you were there for years. If people want to get in contact and support you, or just to find out more information, what would you recommend?
It's really easy to get in touch with Sightsavers, and there are so many ways you can support our work. You can go onto our website, which is very simple. It's sightsavers.ie. You can find us on Facebook and Twitter. You can call us on the phone, and you can also get in touch by calling into our office. And as Darren said, we're here on Spencer Row in Dublin City Centre. So we'd welcome people to have a look online, pick up the phone, drop us an email, send us a Facebook message, however you want to get in touch. But there are so many ways that you can support Sightsavers, so please do have a look.
Yeah, and you have a newsletter. Is it a quarterly newsletter? You get it by email. You get it in the post as well. Yeah,
we have. I suppose it's incredible how many good news stories every day come through of people who've got their sight back. So each quarter, we just like to share that with people who are helping make it happen. And so we have something called Focus Magazine, which is shared 4 times a year. We can share that by email, or some people prefer to receive it in the post. And so anyone who's interested in that can drop us an email or have a look on our website where you can download that. And you might see that on our Facebook page. And as Darren already mentioned, we have loads and loads of nice videos up there for people to have a look at. So as I say, have a look at sightsavers.ie or get in touch in any way, and we'll happily share that information.